This is Unique Smiles, the Facial Paralysis Podcast, and I'm your host, Brian April. So today on the podcast, joined by Jane Mateik. She has facial paralysis from a result of a surgery, and I've known Jane for a few years now. Jane, thank you so much for joining me today.
Thank you for having me.
And I guess let's start by having you tell a little bit of your story.
Okay. Well, back in 2010 is when it started for me. I started having very slight throbbing on the right side of my temple, and it was inconsistent. It might be once or twice a day and then not happen for 2-3 days. And that went on for a while, months. And I was the type that didn't get sick. I didn't get headaches. I was just like, what's this? And then it started to get a little bit of a sharp shooting pain. But when something hurts, you usually touch your hand to it and go, ow. But by the time my hand got to my forehead, it already was gone. So this went on for a few months. And finally I said, okay, something's not right. And I went to my primary doctor. And she wrote it up. And at the time, my husband was in the military, so we had this specific insurance called TRICARE. And they thought that doing a whole MRI or whatever test they were suggesting was not worth it to check it out for a little throbbing. So they said no. And I kind of told myself, if they're not worried about it, I guess I shouldn't be. So months go on, and it starts to happen a little more often. And I go back to her, and she refers me to an ENT, ears, nose, throat doctor. And he takes blood work, and he comes back. He says, everything's fine. He goes, maybe don't chew so much gum, like they're having a, jaw situation. And I'm thinking, I don't chew that much gum, and, maybe you're a little bit on a quack. But I left thinking, okay. And then as it went on, about a month or so later, it's starting to get more often. And I actually went to a KISS concert, and it was so loud and pounding that it seemed to explode that night, where it just was just nonstop pounding. So I called the ears, nose, throat doctor back and said, I'm not chewing gum, and just something's not right. He sent me to a neurosurgeon, and he also said to me, well, we can do an MRI, and his comment was, it's probably overkill. But because he's a specialist, the insurance approved it. Now, during that time in my life, my husband was a active duty Navy chief, and we were about to get transferred to Souda Bay Creek, Greece. We had already shipped my car, some furniture, clothing, and he was going to go ahead for about a month and get everything set up, and I was going to fly in. And the neurologist called me up, and he said, we have the results. And he said that you have a tumor about the size of a peach in your head. And, everything stopped. Wasn't going to Greece. Fortunately, the Navy, accommodated my husband and stopped his orders. And 10 days later, I was up at UCLA Hospital having 10-hour brain surgery. They said that most likely it was either a meningioma or schwannoma, and both of them tend not to be cancerous. But it was so big, it was pushing on things. They were actually shocked I didn't have some type of facial paralysis showing up. So we went in there, and I woke up, and I had immediate paralysis. The entire right side of my face, from the top of my forehead down to my throat, was completely paralyzed. Now, they told my family they did not cut the nerve. So even though it was scary, my attitude was, okay, well, it's going to heal. They told me they didn't cut the nerve, so I just have to kind of deal with this until it comes back. And I threw myself I found a therapist because I did need to talk through it. I went to acupuncture. I went to a physical therapist that would, push on my brain, and they even tried electrical stimulation, which I was told after the fact is not necessarily the best thing for me. And after a full year, nothing had changed at all. And at that point, it was very clear that I had permanent, facial paralysis.
Let me stop you right there real quick. I just have to say this because I hear it over and over with all of these stories. The amount of negligence or incompetence or lack of knowledge that the medical profession seems to have towards any of this. The fact that, for me, it was dismissed as TMJ, and then it was just cluster headaches. And there's so many other people that have the same thing. Like, oh, you're fine, you're fine, you're fine. And then, soon all of a sudden it's, oh, you have this, you have this tumor or
right.
you have this other problem. And it's baffling to me that there can be so little, effort put into in the beginning.
Hmm.
Anyway, just my little rant. Sorry.
No, absolutely. I mean, this went on technically, if you spread it all out, almost a year with no treatment. Now, unfortunately, they can't tell me what caused this. I mean, did I go in a couple of tanning beds and lay out at the beach, or, put my cell phone up to my ear? I mean, they'll never know. They'll never know how long it was there, what caused it. They didn't know for sure if it was cancerous until they actually went in there and then, took a piece of it to the lab, and I was graced with the fact that it was non-cancerous. The plan was to go in and take the bulk of the tumor out and leave just the thinnest sheet of it because it was touching my nerve, and so that I would not wake up and have paralysis. So they did leave some tumor up there, and I woke up and I still was paralyzed. I remember I my friends kind of thought it was funny because when I had a positive attitude, and when the doctor said, you have a brain tumor, the first question out of my mind, honestly, was not, oh my gosh, am I going to die? It was like, you have to cut my hair? And I was like, okay, no, no, no. You need to, just take the minimal amount and, don't shave the whole side of the head. We'll just get a little bit of the cornrow going there. And they did it too. But that was my big thing. It's like, it was all about vanity. I wasn't really worried about, am I going to die? Maybe because they kept saying these tend not to be cancerous, but it definitely was a scary thing. I knew it was going to be a 10-hour brain surgery, so that's a long time to be under. But as I said, my plan was get this thing out of me. It was interesting because once they told me I had a brain tumor prior to my knowledge, and I'd get some throbbing or sharp shooting pain, it was like, ugh, that's annoying kind of thing. Because it wasn't really that bad, but it just was like, this isn't normal. And then they told me I had a tumor, and every time then, before I had the surgery, I would feel it throb or give me that little shock of pain. Then it was like, oh my gosh, get this thing out of me. And my attitude was get in, get it out, and let me get on with my life.
And
And
leave my hair
that's not,
alone.
and leave my hair alone. And that's not what I woke up to.
And you said
So,
that after a year that you just kind of realized that you have permanent facial paralysis.
right. Well, they kind of told me if I don't see any signs of anything, that's a pretty good indicator that it's not going to come back and it's permanent. I had met with a amazing doctor, Dr. Babak Azizadeh, who's in Beverly Hills, prior to that year, just for a consultation. And he knew that I was really, I really wanted it to come back naturally. And he was very patient with me, very kind. His staff was amazing. He said, "Well, okay, we're at the 7 month mark. Let's wait." And I came back, and a year later, nothing had changed, and I had a period of time of I need to do something, or it could stay completely permanently paralyzed. So the option, and I know that there's a few different plans because everybody has a little bit, a little quirk here and there with their issues, whether it's Bell's palsy or an accident. Mine was nerve damage. Um, there's those that have paralysis from birth, and he said that, and I am not a medical clinician, so excuse me with my terminology, but he shared with me they would take nerve from my right ankle and put it up on the left side of my face, which was the healthy side, and go behind my ear, and they would tie the nerve to another nerve in my face and pull it across, and this is all underneath. You don't see it, and like an extension cord. And they had to wait 9 months for that to bond and heal. Then they went in and opened up my left thigh and took some muscle from that. And then they opened up the bad side, the right side behind the ear. Again, you don't see any scars. And they put the muscle in and then attached the nerve to the muscle where I am now able to make movement. I don't, I will never be able to have my big, huge, smiley, pearly white teeth showing, but I can absolutely give a soft smile that looks symmetrical, and it has made a complete difference for me. I also had two other surgeries, and that was with my right eye. They first put in a little gold weight in my eyelid, which seemed really kind of crazy that something could fit in there, but it does, and it helps to have my eye lower a little bit. Because imagine taking your eye and opening it, holding it open. So wind, dust, sun, I mean, so you're constantly putting drops in it. Some people have to try to tape their eye closed at night. I don't, so I'm very happy about that. And if it gets super sore, maybe at night I'll put a little ointment in it and drops throughout the day. But
Can you
that
can you blink?
um, it's mechanical. I have to think. My left eye just blinks,
Right.
constantly, and my right eye does not unless I am thinking, okay, it's getting a little sore, and then I just kind of squeeze my muscles, and you will see my eye come down. In the very beginning, it did not come down 100%. You could just see the slightest part of white of my eye, but through the years and maybe aging and a little extra skin up there, it seems to close all the way now. So I can go to sleep at night and close my eye, and I don't, I don't know if my husband can see it open a little bit while I'm sleeping or not, but when I wake up, I'm not sore. So I presume, it it stayed as closed as possible. There's also tricks that you can do. You can lay on your bad eye a certain way with your pillow and kind of take your eye and then kind of, scoot up into the pillow so that it's kind of like the pillow's holding it closed. And there's a lot of little tricks that you can do, and that's worked for me. But it's definitely a journey. For me, if they had told me from the get go, you have nerve damage and this is where you're at, I would have jumped on the surgery immediately. So it definitely was an emotional roller coaster that first year. Is it going to come back? They told me it's going to. I just have to wait. I do all these things and exercises, and I'd stare in the mirror looking to see something, and there was nothing to see. So
Now, was it? Sorry to interrupt. Was it full? The nerve was fully cut. Was that correct?
well, they claimed it wasn't, but
Right.
I have fully facial paralysis. So I will say, when I was at the hospital, UCLA is a teaching hospital, and I did ask them, and now that I think back, I can't imagine me actually wanting to watch a tape where I'm laying on a table and they're drilling my head and pulling my face off to get to this. But I had asked to see a copy of it, and they said not a problem, especially because they said it was my brain tumor was in a odd, you know, place, and they don't see a lot of those. So they said they were going to tape it, and when I was getting ready to leave the hospital, I asked for a copy of it, and they didn't have one. So they said that the nurse forgot to hit play, and I do understand that this isn't just stitching up a little finger. This is, again, they had to cut open my head, cut my jaw, get to the area, and the tumor is in there wrapped around, you know, Lord knows what, and to try to get it out without pulling, stretching, cutting, nipping something in such a small area is difficult. So I'm sure they tried their best, and but the results were, what they were.
So after the initial surgery and the initial paralysis, I think for me, one of the hardest things was being told that yes, it's going to come back and it's going to come back at, at this certain amount of time. And then when that doesn't happen, that is just emotionally devastating. How was that for you? How hard was that?
Oh, absolutely hard. I went through a few different therapists that I'd go and talk to, and you surprise yourself because, like, as I'm speaking to you now, in my own brain, it's just Jane talking, and I feel Jane. But when I walk past a mirror, that's not the Jane that I used to be. It's not the look that I used to have, and it took a really long time for me to, accept my new normal. And I found that if I ran into old people that I hadn't seen for years, that each time that happened, I would go through that little bit of, uncomfortableness of, oh, they're going to see me for the first time looking different. The truth is after they see me, and of course I have to explain what happened, not in detail, but this is why I look like this. I had a brain tumor and I woke up paralyzed, and they're like, oh, that's terrible. And then carry on with the conversation. So I've learned that the person that, has the hardest time with this is myself, not other people. And I think about it, I try to think about it, how would I treat someone that I know, or a friend or family member that just happened to them? Would I look at them and feel any differently about them? No. I mean, would I look at them and think, yes, they do look different, and that's a shame, but I wouldn't care about them or love them any less. And so I think a lot of us who go through this have to really learn to accept ourselves before other people are learning to accept us.
Absolutely. One of the funny
I,
things that happened for me was I saw a video of myself recently before I ended up with facial paralysis, and I didn't
mhm,
recognize myself at that
mhm,
point. I'd gotten so accustomed to what I look like now that I was like, "Who is that?" And I'm like, "Oh, that's me."
mhm,
So
right.
I guess with that, so for someone who's just got facial paralysis and is afraid or uncomfortable with maybe talking to their friends, going out in public, do you have any sort of advice or tips or tricks that might help them?
Well, for me, all of my loved ones and friends, including my husband, were very supportive. So I was lucky with that. But what I needed, and no one really told me where to go, was I needed a support group. And it took a minute to find it, but there's an amazing support group, and it's facialparalysisfoundation.org. And they meet maybe 4 times a year. They do a walkathon either in Santa Monica or Long Beach, and you meet friends. And it's interesting when I'm in public with my mouth and how I talk. If you walk past me, you wouldn't look at me and say, oh, something happened to her. But it's more noticeable when I start talking because, there still is paralysis. And I find that when I go to these support groups, that I can just talk, not try to, you know, slow down my conversation, because in my mind, I think if I'm talking slower, my mouth looks more symmetrical. And if I laugh or smile, if I just really do a huge laugh, that's when you really can see more of the paralysis, where I try to control my smile so I will stop smile. Now, when I'm with my support group, I just let it rip, because I know that every person sitting there has experienced the same thing, going through the same thing. Some people get improvement and others don't, but there's no judgment. And I think that women for sure tend to flock to this, and I see less men. And I don't know if men are kind of macho and they think they don't need it or they don't care. You know, battle scars are sexy. I don't know, but I think that there is space out there for them. That's absolutely wrong. We're getting more men in our support group, and we're all just becoming friends, and it does really, really help.
Based on my experience, and I go to the same support groups that you do,
Mhm.
It's a the way there was a beauty standard, I think, for most women with, Cosmo magazine and TV, there's kind of an emotional standard for men. And I mean, thankfully that's changing over the years as we're,
Mm.
delving more into mental health and things like that. But I
Mhm.
think there's this appearance of macho, and a guy wants to feel attractive because that's his role, is to, find a mate. And, you know, every guy thinks that every woman wants to date him. And that's just kind of, it can be really hard when you lose that sense of masculinity, or what you perceive to be as masculinity. So I think that's probably why there are fewer men in the support groups, and the whole sharing your feelings and, crying and all of these things that were hammered into us older men, when we were younger. You don't cry, you don't show your emotions, you don't show weakness, that sort of thing.
Mhm.
But again, thankfully that's changing now. So
Well, and it should because you said something about, the machismo of men feeling that they have to look like, a healthy male. It's the same thing for women. I mean, I personally think from a woman's point of view, it's worse because women, everything of, it's based on our looks. And I've said this before, God bless all the women that have had, breast cancer and had to struggle through that. But I've actually said to myself, if I had to choose, I would have rather had breast cancer than facial paralysis because your face is what, the world sees. And I'm not knocking breast cancer by no means. I'm just saying for me personally, that would have been emotionally easier for me to deal with because at least I can hide it. You can put on a bra, there's things you can do for that. But with your face, you really can't hide what's happened to you. I was fortunate to have been married at the time this happened, and my husband was a huge support and would say, I don't see a difference. And I actually would get mad at him because there is a difference. But he's saying, my love for you has not changed. For men or women that this happens to when they're still single, I'm sure it's intimidating to think, who out there would find me attractive looking different? And there are support groups for that as well. And by the way, there are many women that were born. One of our co-founders um, for our support group was born with the paralysis, and she's had a family. She's helped run the organization, and she's just amazing. And you do have your groups of personalities where some people are having a much harder time with it. I think time also helped because in the beginning, I literally would have full on meltdowns in the privacy of my own home. But as time has gone on, I've learned to accept myself and to, not let it get to me. I was talking with a girlfriend. I have a very dear friend of many, many, many years. And normally we don't do FaceTime, but we were on computers and we were having our little girl spat. And so when, obviously when you're kind of arguing with somebody or going back and forth, you're talking faster, you're not really watching what you're doing. I'm saying things to her and in an escalated way, and all of a sudden my computer flipped where it showed myself talking, and it was a shock. I mean, an absolute shock to me because I'd never really seen myself aggressively talking, and it just hit me like a ton of bricks because I thought, this is what everybody else sees. Because in my mind, I don't see that, and I actually saw myself talking in a uncontrolled fashion, and it definitely was an eye opener for me. But no, I do. I mean, it's been 10 years. I'm not young. I'm 60 years old. Dr. Babak Azizadeh is the amazing doctor that did my reconstruction surgeries, and he does have some patients that are considering the surgery, and they're scared, and likely so. And he knows that if there's any of his patients that kind of want to ask, what did I go through? What was it like? Was it painful? How long was the recovery? All the questions. He'll always ask. His staff will ask if they'll call me each time and say, "Would you be willing to talk to, this gal?" And I always do. So I take each and every person personally that's about to, trying to decide a journey. And, I've asked questions myself, like right now, as I age, I have one side that looks, actually, I look pretty good. I don't look like I'm 60, but the one side has, my forehead has my frown lines, and then the other side looks like I'm cut in half and that I'm still, you know, 40 years old with, or even it looks 20 because I have no, lines on the paralyzed side. So not on a regular basis. I will let it go for some time, but I do Botox, and then when I make a expression with my eyebrows, it looks the same.
Hmm.
So I try to stay as symmetrical as I can because it just emotionally makes me feel better. I feel I look better, and that's where we're going
Well,
with that.
and
I have.
you look, amazing. I've seen your pictures. You have a book that you sometimes bring to the support group to show like before and after. And
Mhm.
actually, if people want to
Mhm.
see some of the before and afters and read a little bit more about the story, you can go to facialparalysisfoundation.org and then go to their supports group tab, and there'll be something that says stories from our group members, and you will find Jane's story right in there, as well as mine too. And I still have my fat picture up, which, man, I need to get that replaced. I don't look like that anymore. So, but
I
so
mean, sometimes. Oh no, I was just going to say, and sometimes you have to make fun of it. So I was driving along and I had just gotten a fairly new car and I had saved a long time for it. And I was turning right on a very busy street that had a yield sign and there was cars coming. So as I went around the bend, I had to yield because I couldn't go. And all of a sudden I got hit from behind. And it was a guy kind of in a little bit of a, an older car. And I looked in my rearview mirror and he had a dog sitting on his lap. He had a cell phone in his hand, and we pulled over off the street into, there happened to be a little parking lot there. I pulled over, he pulled in, and I was angry because it's like this could have been avoided, and this was my brand new car. And he gets out of the car and he looks at me and he goes, "Are you okay?" And the first thing in my thoughts was to say to me, "Oh my God, I can't move my face." And I wanted to, just kind of scare him a little bit. And I kept my tongue. I didn't. I said, "No, I'm fine." But I wanted to because I thought, well, I might as well use this for something fun.
right.
And that would have shocked him, I'm sure.
Well, and
Oh
you
God,
have
I
one
just paralyzed this woman.
one of the great things about you, from what I've learned, is you do have a great sense of humor with it. And I think that's because it's been a few years, like you said, you start to accept who you are. And I think that's
Hmm.
really important to be able to just at least talk openly and honestly and just kind of say like, yeah, I'm still alive, I'm still here
Oh,
doing this. And
absolutely. I was a foster mommy to a little girl for 2 years. I received her when she was 4 days old and had her till she was two. And there was a time where, when she was real little, I can't remember, 2 months, 3 months old, and I took a million pictures of her. And I happened to know her grandmother. And there was a picture of her that I caught that she completely, one eye was open, one was closed, and then one side of her mouth was open and the other wasn't. And again, it was just catching it at that moment. And I sent it to her grandmother, and she knows me well. And my caption was, "Maybe I shouldn't be the one teaching her how to smile," and because she looked very unsymmetrical. And of course, her grandmother just laughed and she said, "Oh my God, Jane, why would you say that?" And I go, "Well, I'm laughing."
that's funny.
So,
Well, and speaking
you
of,
know,
of, of pictures, how do you Because you're a social butterfly, how do you deal with people always, going out and taking pictures, social media, all that sort of stuff?
Well, I'll tell you the first time not the first time, but one of the times that I went out with a whole group of girlfriends, there was about 5 or 6 of us, and I was having a great time. I mean, I was really enjoying myself, and everyone's like, okay, let's take a group picture. And we take it, and I had it on my phone, and I get into the car with one of my good friends, and I go to look at it, and I literally I had a little meltdown. I started to cry because I knew inside I felt so happy, and all my girlfriends were smiling ear to ear, and I looked like I was just pissed. I looked miserable. Yet I knew that that wasn't the case, but in the picture that was taken, that's just how I looked. And so that was upsetting for me. So the next time I got together with the girls, everyone saying smile, and I tried my best. And then I insisted with the whole group. I said, okay, now we're doing one for me. I don't want one single one of you to smile. Just look at the camera. And they all laughed and they said, okay. And so we took a second picture with all of us just looking stone cold. Here we are. And that was kind of fun. And they all went with it. And you make concessions. I remember when, before I had my reconstruction surgery, if I had to walk into a room, the first thing I would do is look for a chair that had an arm on it, because I would put my right arm on the chair rest and then put my hand up to my cheek and kind of hold it up, because how funny would it look like if I'm just standing in the middle of the room holding my hand up to my cheek? So I always made sure, where's the chair for me, and where can I go and try to hide, some of this deficit as well as I can. And there's a lot of things that people don't know about. The fact that my right side has the paralysis, my eye doesn't blink, so I have the weight in it. If I cry, tears don't come out of my right eye. It doesn't produce tears. And my my breathing is not as good on the right side as the left, because we all have muscles that go on the inside and around your nose. You don't realize any of these things, but it's just there. So if I kind of pull at my cheek and pull my nostril a little bit, I can breathe clearer than I can with it just being as it is. The other thing that nobody understands is that your saliva glands can be affected. And so my mouth always feels like the Sahara Desert. So you will now see me chewing gum or having a mint or drinking a lot of water. We also have to be extra careful with our teeth, because you don't have the saliva, so you tend to, get more cavities. I never had any problems with my teeth until all this happened, and then next thing you know, I'm having a lot of different issues. So my dentist did say, drink a lot of water, because if you're not naturally, being able to swallow a lot, then flush it. So that's, a good trick for that. I wanted to get back to skiing, and of course, going down a mountain full speed with, that wind going in your eyes, they have special goggles. They have special sunglasses that you can purchase that look, not like goggles. They're more, sexy looking, but they protect your eye from the wind. So there's a lot of little tricks that you can do to, help yourself physically and mask some of the issues.
Very cool. One more question, I think. What other advice would you have for someone who's just getting facial paralysis on maybe how do they treat themselves in the beginning, and what is a reason and maybe to, continue to just pursue things in life, like to get out there and just chase?
Well, when it first happens, I would love to meet the person that this happens to, and they go, "Oh well, it's life," and carry on. Uh, we we all do that, but we all take our own time of healing and acceptance. And whether it's reconstruction surgeries or not everyone who can have reconstruction surgery and make a difference even want it. It's like women with mastectomies. Some want they want to have reconstruction, and another ones say, I'm done. This is this is what I accept. So that's basically a personal issue, I think. But at the end of the day, you know, I'm still here. And that's the first thing I hear. Well, God bless that you're still here, and that's true. But you only have one life. And so you have to make, what life you have the most peaceful and exciting and loving and, giving back, as I said, willing to talk with others that are going through it. And some people are going to get an improvement and some people are not. And the biggest thing is learning acceptance. And again, for me, my support group, and I have a lot of friends, not well, enough, and they all love me and support me. So I get that from them. But personally, finding a group that look like me and I know they know what I'm feeling is so helpful. And anyone who's out there who's listening to this, if you don't have facial paralysis, but you know someone who does, I would definitely suggest giving them the links and giving them the contacts and, try one meeting. And I promise you, you'll probably come back to many more because it really is a great support group with really great people. I mean, you have all different walks of life that come to this meeting, and it's a very soft place to fall and good people to meet, and I'm very happy I did. And Brian, who I'm talking to, I met you there, and
Absolutely.
I think we have a great connection. So
Absolutely. And I guess lastly,
yeah,
for people who may not be in the Southern California area, if you go to
hmm
the facialparalysis.foundation.org site, you can find out they do online support groups and webinars and places where you can get some information as well. So it's a
hmm
really great resource to find out more information, connect with people, and it's just wonderful. And there are also plenty of groups on Facebook and all over the internet now. So
yeah, I
there's no
definitely.
need to struggle alone anymore.
No, absolutely. I would say that's the biggest thing. And when this first happened to me, and again, this is 10 years ago, there really wasn't anything out there. And, there's thousands of people with facial paralysis, whether, again, as I said, it's cell palsy, um, tumors, surgeries, accidents from birth. It doesn't matter how you got it, but we all come together and it's like a family. And I can't recommend it enough.
Well, Jane, thank you so much for taking some time today. I think this is really going to help some people. And I always love talking with you. Looking forward to seeing you at the next support group we end up at. And I just
Absolutely.
wish you nothing but the best. And thanks again and for taking the time.